So good morning. I'm Dr. Dale Bratzler. I'm the Enterprise Chief Quality Officer here at OU Health and also the University Chief COVID Officer. So good morning. I'm going to give you just a brief update on where we're at now in Oklahoma with respect to the pandemic, the recent stats, although I know that many of the news outlets now do a very good job of keeping track of all of that data now. So just a few moments ago, data was updated from the State Health Department. We're just under 230,000 cases now in Oklahoma, and sadly we crossed more than 2,000 deaths, 2,007 deaths total since the start of the pandemic. There were 3,900 new cases that were reported today, which is the highest number we've seen now for a few days. In the past week, we've seen 20,478 new cases that have been confirmed in Oklahoma. And again, sadly, 147 people have died this past week. One thing I did want to point out in the handout that will be distributed is that both the 3-day and the 7-day rolling average, which had been actually trending downward now, have reversed and are starting to trend back up again. We've seen a plateau in the number of cases over the past week or so, but again, the 7-day rolling average now is starting to trend back up. Currently, as of today, we're at 2,925 new cases per day on average. Rural spread of the disease continues to be prominent in Oklahoma. I'm going to highlight today Alfalfa County, which is right up on the Kansas border. Since the start of the pandemic, Alfalfa County's only had 573 cases, but 171 of those were confirmed in the past week. So we're seeing that in many of the rural counties, that though their total case counts are relatively low, they're seeing a lot of new spread of the virus in those communities. Again, if you look at the maps that I provided, eastern Oklahoma continues to be doing a bit better than western Oklahoma with respect to the spread of the disease. Testing in Oklahoma, so far for the first 4 days of this week, just under 14% of all the tests that were run were positive. Last week it was a bit higher. We'll see what shows up when the data comes out today and tomorrow. As of today, there were 1,730 patients in the hospital in the state. This is as of yesterday. 456, or about 26% of those patients, are in the intensive care unit. One thing I have noticed, and that's very obvious on the graphics that I sent out, is that hospitalizations have plateaued now for about the past 2 weeks. Each week I like to try to highlight some of the articles that have come out in the past week, and there are 3 that I want to mention. The first one I think is very, very relevant, particularly with the news this week. It was a systematic study looking at where COVID-19, where the virus is transmitted, indoors versus outdoors. And what they found in the study was that indoor transmission was 18.7 times more likely than outdoor transmission. So clearly, as we've highlighted many, many times, being at indoor events with people, particularly when people aren't wearing masks, dramatically increases the risk of transmission of this particular virus. Now, that doesn't mean it never spreads outdoors. It did, but what they found was that outdoor events, the risk of transmission was tied to the duration of the event, how close people were outdoors, and were they wearing personal protective equipment, particularly masks. And then if you have an outdoor event, as an example, but everybody has to go in, let's say, for a buffet or do something like that, if you pull people indoors from an outdoor event, that increased the likelihood of transmission in the outdoor setting. But again, I'm very happy with the executive order yesterday that the governor gave to limit the size of indoor events, because indoors, when people aren't wearing masks, is where transmission occurs. The studies are clear that restaurants, bars, gyms, offices, places of worship are places where people get infected. So it's very, very important that if you're at indoor events with other people, that everybody be in a mask to slow the spread of this particular disease. The second study I wanted to highlight was just published yesterday. It came from the journal JAMA Oncology, a very large study, 73 million Americans with a diagnosis of cancer. And a couple of things, the study came from Case Western Reserve University in Cleveland. A couple of things that were very, very clear. First, patients with a recent cancer diagnosis were 7 times more likely to get COVID-19. So again, as the holidays approach, if you have family members that are currently being treated or recently treated for cancer, they're very high risk for this infection. Please protect them and try to avoid bringing them into those settings. African Americans with cancer had a much higher risk of infection with COVID-19 than white patients with cancer. And then I put a graphic in the handout that shows that patients with cancer, if they get COVID, are much, much more likely to be hospitalized and much more likely to die from COVID-19. So cancer is a substantial risk factor. And again, if you have family members with cancer, please protect them. And then the last thing I wanted to highlight comes from the FDA's briefing document about the vaccine that's now being approved for distribution. So we expect today the actual emergency use authorization would come out. And I want to just highlight the things that we don't know about the new vaccine that were highlighted very well in the FDA's briefing document. The first is, how long will immunity last after you get the vaccine? We just don't know. Remember, FDA is approving this vaccine based on 2 months worth of follow-up data in the study participants. So we're not going to know how long duration is of the vaccine, the immunity is going to last. We think it'll be for quite a while, but we just don't know yet. Will the vaccine be effective in high-risk groups that are immunosuppressed, like HIV patients, those cancer patients I just talked about, patients that are on immunosuppressive agents for diseases like rheumatoid arthritis or lupus? We simply don't know yet how effective the vaccine will be because there weren't enough of those patients in the study to make conclusive decisions. If you've previously had COVID-19, how well will the vaccine work? That's another complete unknown. Remember, the vaccine will be approved for kids 16 and over, so we don't know yet how it will work in kids under the age of 16. One of the questions that still exist is, once we really roll out this vaccine and millions of doses are rolled out, will we see mutations of the virus? Will it mutate like influenza does? Will there have to be a new or different formulated vaccine in the future? Completely unknown at this point. And then I think perhaps most importantly, will the vaccine prevent asymptomatic infection? In other words, the study that showed that it was 95% effective was based on symptomatic disease. So if you were exposed, did you develop symptoms and were diagnosed with COVID-19? We don't know, though, whether or not the vaccine prevents asymptomatic disease. In other words, if you've had the vaccine, can you still get infected? Can you still shed the virus and potentially spread it to others, even though you don't get sick? You don't have symptomatic COVID-19. That's a good outcome to not get symptomatic, but we don't know whether it will protect you from spreading the virus to other people. So the important message with distribution of the vaccine is going to be that we can't stop wearing masks. We have to continue to do physical distancing. We have to continue doing effective hand hygiene until the questions have been answered about duration and whether this vaccine will actually prevent spread of the virus. So I'll stop there.
Quick question about the rural numbers that you gave. Is the timing such that we think that might be related to Thanksgiving? Or?
So the question is about rural transmission. So for several weeks now, I've been seeing substantial increases in transmission in Oklahoma and our rural counties. And I think at the start of the pandemic, perhaps they were a bit insulated because people lived farther apart and we were seeing most of the spread of the virus in our populous counties. But now it's very much spreading in rural counties. And again, remember where people get this infection. It's when you bring people together indoors at events. That's when transmission occurs. It doesn't occur when you're outside on your family farm or other places, but it's when you come together. So if you're going to a restaurant, if you go to a meeting room, if you go to a place of worship and you're not wearing masks, that's where the vaccine is being spread in rural communities. So we've just seen a lot of spread in rural Oklahoma. I don't know why western Oklahoma has higher rates right now than eastern Oklahoma. Certainly the weather has been much worse in western and northwestern Oklahoma with the snowstorms and colder temperature. Perhaps that explains part of the difference. I just don't know yet why we're seeing that difference.
Dr. Mantor, if you'll first introduce yourself, and then let's talk about what the hospital bed situation is looking like right now.
I'm Dr. Cameron Mantor. I'm the Acting Chief Medical Officer for OU Health. And currently the bed status at OU Health looks reasonable, I would say. We have ICU beds both for COVID and non-COVID patients. We also have med-surg beds for COVID and non-COVID patients, and so we are at a relatively good spot right now. But we're also accomplishing that by increasing significantly the number of beds that we have. Over the past 3, maybe now 4 weeks within our region, all of our hospitals in 6 and 8, we've actually increased our bed capacity by over 30% in just this area. So the fact that we do have beds is a combination of that, but it is in fact at a good spot right now. But when you look at our patients holding in the emergency room, we still have patients holding in the emergency room looking for trying to get into a bed. And so you hear us talk about it being an hour-by-hour process. We're constantly managing the throughput of patients. Those can be discharged to home. Those can be sent from an ICU to a med-surg bed to get those into the ICU. But at the current time, we do have bed availability.
I know you're a member of the Chief Medical Officer group. Is there a discussion that we fear that we'll go into Tier 4, or do we feel like we're kind of leveling out right now?
So we've been in Tier 3 in Region 6 and 8 for a number of weeks now. The likelihood of us reaching Tier 4 is undetermined. That's at 40% of occupancy. Right now, Tier 8 is just under 30% and Tier 6 is just over 30%. So as a region, we're right at about 30%. And we have stayed between 28 and 33, 34% for quite a number of weeks now. I believe Dr. Bratzler talked about although the number of cases went down shortly after Thanksgiving, they're back on the rise. But if you look at the rolling average over the past couple of weeks, it's been fairly stable. We don't know if that is a long-term effect or if we're going to see it start to trend down. We don't know the answer to that yet.
Okay. And how is staffing looking? I know we've been kind of creative in trying to add more staff to certain areas, and I assume other hospitals are doing the same. I know in general, though, there's a staffing shortage. Right?
So I would tell you that all of the hospitals in the region are working together. We're talking to all the chief nursing officers across our systems, determine what's working, what's not working. But right now, everyone is stretching their staff. It's a combination of creating new beds, but also a combination of our staff being out on quarantine or becoming ill with the virus. And so we are clearly stressing the situation. I've talked before about the fact that when people go into medicine, they realize it's not easy. It's not easy being a nurse or a physician, but we know that. That's why we go into this profession understanding that. But I think what's causing significant stress and workload problems is the fact that we don't see it declining in the community. I think once we see it really declining in the community, then I think the staff and the providers will feel somewhat more comfortable that, okay, we've gotten to a spot we're going in the right direction. But things are still very challenging. We're stretching our staffing ratios to be able to take care of both patients who are sick with the virus, but also all the other Oklahomans that need care, whether it be cancer or trauma or general med-surgical issues.
So staff works all the time, obviously, because a sick person doesn't not get sick on Christmas. So, but we're in the next 2 weeks is Christmas, and staff is already stretched. I mean, just talk to how challenging that is emotionally and physically for our staff, doctors and everybody.
It's certainly a very challenging time, just like Thanksgiving was. Holidays are about family, and doctors and nurses, we all want to be with our families. We would like to have time off, but as you said, our patients don't recognize holidays. Patients are sick when they're ill, and when they're ill, they need to be in the hospital. So unlike almost every other business, A hospital is not a seasonal business. It's busy during holiday times. Now, patients wanting to come in and have truly elective type operations, that typically doesn't happen over the holidays, and so there is a little bit of a break from the need for hospitalization for some of those patients. But we still have to have staff around the clock to take care of patients on every day of the holiday season, and so it's challenging. It is.
Dr. Bratzler?
I've had several people asking about the new executive order measures, if we feel like they're going to help, and if help off, I'm sorry, I'm not reading this very well, and also on the fact that churches, sorry.
Yeah, so the question is about the governor's executive order yesterday limiting the size of indoor gatherings, and I'm completely supportive of it, and I really applaud the governor for doing that because I think it's important. It's one of the reasons I highlighted that story that came out this week from the Journal of Infectious Diseases that showed that the risk of transmitting the virus is 18 times higher indoors than it is outdoors. I do, have concerns about not limiting the size of crowds within places of worship. And I think many of the churches in Oklahoma have taken a lot of activities to reduce the size of the crowds that are in the church. But it doesn't matter what the indoor setting is, whether it's a restaurant, a church, an office. If you bring people close together indoors and they're not wearing masks, you increase the risk of transmission of the virus. I was particularly happy to hear the governor mention indoor sporting events, particularly high school games like basketball games and other things, because we know that if you pack a high school stadium with parents and grandparents who are yelling, cheering their kids or grandkids on, that's a high risk for transmission of the virus. So limiting the capacity in those indoor sporting events is incredibly important to reduce the spread of the virus.
Can I comment on that too? I want to add something to it. Bratzler's comments, as I listened to the press conference yesterday, it was clear that we are trying to reduce the number of people that are at indoor events, restaurants, churches, and indoor sporting events. But I do not believe that part of the executive order required masking inside. And so I think unless people truly socially distance inside a reduced venue, if we're not masking, there is still a great risk for transmission of the virus. And it just, I think it accentuates the idea that that when you are indoors, wearing a mask is of paramount importance to try to prevent the spread of the virus, unless you're truly socially distanced. Sporting events, parents are excited about their kids, and we all yell and scream and cheer. And unless we're masked, that is going to be an ongoing problem.
So I'll keep adding on, and that is, so we've done a lot of planning for basketball events at the University of Oklahoma. We're going to have less than 20% capacity indoors in Gallagher-Iba, I'm sorry. Yeah, Lloyd Noble. Yeah, complete. So we're going to have less than 20% capacity at Lloyd Noble, and we are going to absolutely require masks to be worn if you're in the stands, because 6 feet is arbitrary, and it's been well demonstrated that the virus can travel more than 6 feet, particularly if people aren't in masks and they're yelling or singing. Those types of events spread the virus long distances.
Someone was asking about the existing restrictions that we have on bars and restaurants. Do we feel like
It's a bit early, so the question is about the existing restrictions, closing bars and restaurants at 11 p.m. And requiring 6 feet of spacing or physical barriers. So all of those things I think could be helpful. I just don't know at this point whether or not they're substantially changing. because my impression, particularly for some bars and other places, is that I see, all you have to do is drive down the street and you can see lots of activity in the parking lots and others, that there are a lot of events that are happening much earlier than 11 p.m. And just remember, in places, particularly restaurants and bars, you have to take your mask off if you're going to eat or drink. And so again, that's where the virus gets transmitted, is indoor events.
Are there any new guidelines from the CDC that look promising?
Well, of course, the big news with CDC this week was change to the requirements for quarantine for contacts of a patient with COVID-19, which I think was a good change. So I'll give the example of a student in one of our dormitories. So let's say you have a student that tests positive. We would put them in isolation for 10 days, but we were required to quarantine their roommate for 14 days, which was problematic. So the change basically says that quarantine should last at least 10 days without testing, or you can stop quarantine at day 7 if you get a negative test. And I'll highlight that there have been a couple of studies now that have shown that that strategy of doing a test at day 7 or keeping somebody in quarantine for 10 days with no test is as effective at preventing transmission of the virus as a full 14 days of quarantine. So I think it was a good change. It will get people back to work, back to school, back to usual activities quicker.
Great. Following Thanksgiving, any reminders about Christmas?
Well, Christmas, just like Thanksgiving, as Dr. Mantor pointed out, it's a family holiday. And so if you're going to bring family together, particularly multiple generations, particularly people that don't usually live with you, you increase the risk of spread of the virus. And we know that spread of the virus happens in household events, in family gatherings. So if you're going to do something, we're about 2 weeks out from Christmas now, start thinking about if you can self-isolate yourself or quarantine yourself so that you don't get exposed to the virus before you go to those events. Try to limit the size of those gatherings. I mentioned earlier patients with cancer, but anybody who's older, who has underlying medical conditions, they're at greater risk if they get the virus. So try to think about separating people and not bringing them together in that setting. Wear a mask as much as you can, particularly if you have people who are coming to these events without that don't live in your household. And I don't know what the weather will be like yet around Christmas, but if it's feasible, do activities outdoors because the risk is greater of transmission indoors than it is outdoors.
I should have asked this one when you were talking about the CDC guidelines, and one of the reporters asked if the CDC guidelines do not say which test to take after the 5 to 7 days of quarantine. Is there a concern about the antigen test not providing true accuracy?
Yeah, so the question is about if you're going to get out of quarantine at day 7 with a negative test, which test should you take? Should you take the PCR test or the antigen test? We know the PCR tests are more sensitive, and so if you're positive, it's more likely to be positive. But I believe the CDC guidance basically says either an antigen test or a PCR test is acceptable. I will note that the antigen tests have gotten better in terms of their sensitivity, but just recognize no test is perfect. You can have false negatives with either tests.
I don't have any other questions, so do we have any ending comments?
I think we've covered it.
Yeah. Yep. I think we're good.